KCCI 8 News Close Up. Governor Kim Reynolds' plan to shake up Iowa's tax code. Who could benefit from a flat tax and who might have to pay more? And the Iowa Senate president claims some teachers have a sinister agenda. The obscene material he claims is in school libraries.
This is Iowa's news leader. This is KCCI 8 News Close Up.
Good morning and thank you for joining us. I'm Scott Carpenter. Governor Kim Reynolds calls it a game changer. Her condition of the state address last week came with a plan to shake up Iowa's tax system, starting with a flat income tax rate for all Iowans.
Tonight, I'll introduce a comprehensive bill that significantly cuts taxes for all Iowans. First, it eliminates our complex system of multiple tax brackets and sets one tax rate of 4%, flat and fair. The cuts will occur gradually over the next 4 years so that we protect priorities like education and public safety. But in the first year alone, taxpayers will save almost $500 million. And by 2026, when the bill is fully implemented, an average Iowa family will pay over $1,300 less in taxes. And that's on top of their $1,000 tax cut from the 2018 bill. Also starting next year for Iowans who have worked all their lives and saved for retirement, this bill will do even more by eliminating the taxation of retirement income. For the vast majority of retired Iowans, those who rely on their 401k, IRA, or pension, that's not just an income tax cut. It's a full income tax repeal. And that's how it should be. You've worked hard all of your life, saving for retirement and paying your fair share in taxes. Under my plan, the tax repeal on retirement income won't be limited to bank accounts. For farmers whose savings is as much the black dirt under their boots as the money in the bank, this bill will eliminate the tax on cash rent payments they receive when they retire from farming. And for employees who receive stock in their company for years of hard work, the bill will eliminate the tax on the sale of those shares.
Now, lawmakers on the other side of the aisle say they're skeptical of the governor's plan. Democrats claim Iowans who are on the lower end of the current tax bracket could wind up paying more in taxes.
It's going to be a tax increase for a lot of Iowans. If you work part-time and you're not currently paying the 4% rate, when Republicans talk about cutting income taxes for millionaires and billionaires, it often results in a property tax increase on the backside.
So who are the winners and losers in the governor's flat tax plan? Well, KCCI's Cynthia Fodor asked Kurt Pearson with Compass Financial Services to do the math.
The tax code over the years has been on a graduated scale. So if you take your taxable income, whatever that is, that can elevate you into a different scale, which increases the percentage of tax that you pay or what your tax liability is. And so like if you have $50,000 of income and that bumps you into the 5% state of Iowa tax bracket, you only pay 5% on anything over 50 grand per year. It doesn't go back to $1. And so that's an important thing to keep in mind. And so this idea of a flat tax just simply means that regardless of your income, there would just be a flat percentage that would apply for everyone, regardless of income bracket. Now, part of the kicker, though, and the devil in the details, as always, is exactly what's included in income stream. And I find it very interesting in the proposal, or in what was mentioned, at least in the proposal, is to eliminate retirement income streams from incomes. Well, that begins to have, depending on your age, a potentially very positive impact on if you have to report your income and pay a 4% flat tax on your income here in the state of Iowa, but you're able to eliminate or not count in your income your IPERS payment, for example, payment from your 401k, the required minimum distribution that those over 72 have to take out of IRAs, all that kind of retirement income is now no longer classified as income to pay state tax on. That could have a huge impact for certain segments of the population. The estimate that was in the talk was, it saves about the average Iowan about $1,300 a year by 2026 after it's fully phased in. Keep an eye on those numbers as this proposed idea either gains traction in the legislature or doesn't gain traction in the legislature. Keep an eye on, what components of it are being talked about, what components are still part of the idea for the potential legislation, and how that will end up playing out into what could, finally become law.
So talking about the retirement, so that would be a double bonus, right, for retirees, because they would not be taxed on their retirement income, and then their tax would drop down to 4% as well.
Right. So their it sounds like sources of retirement income would be exempt from counting as income for Iowa tax. And so there would be no 4% flat tax on retirement income in the idea that was presented last night by the governor. And so what that means is that this whole chunk of income that a retiree may be paying Iowa tax on right now would just simply get exempted, and that income wouldn't be counted in their income stream for the tax calculation. So it could have a tremendous impact on the retiree in the state of Iowa, because a chunk of income that they're paying taxes on now may go away with this proposal.
And then they don't sell their house here, so they're still paying property taxes. And then they shop here and they're still paying sales tax. So can you break it down for me in terms of lower income, middle class and higher brackets in terms of, say, so let's start with higher income brackets. What do they pay right now?
Yeah, so
in general,
I think the top Iowa tax bracket is 6.5%, 7%, something like that. And so if they are elevated in their income to that top bracket, they're paying more tax in some of those upper incomes than they would under this new plan. The opposite is also true. If you have some lower income households, they may be paying less than the 4% right now. And it may actually, hurt them a little bit if this flat tax is enacted.
And how about middle class? Do they benefit from this?
Yeah, that's what I'm assuming it means in the I think in a stat that she cited last night, where the average Iowan would save about $1,300 by 2026 when the thing is fully enacted. So they've done a little bit of the math, but it's like any math. I need more details, to really how did the calculation really work,
Well, schools under scrutiny. Lawmakers promise more oversight when it comes to controversial books in their libraries. Why schools say that oversight already exists.
My car is my after-work decompression.
Well, Governor Reynolds and State House Republicans this session are taking aim at some books at school libraries across Iowa.
But for some families, the school district doesn't fit their values or meet the needs of their child. And sadly, in some cases, school administrators are ignoring the problem or just not listening. Some even believe that it's a school's responsibility to not just teach kids to learn, but to control what they learn, to push their worldview. The problem has been building for some time, but parents are no longer in the dark. Recently, several parents brought to light that schools are buying and teaching with books that contain vulgar and sexually explicit material involving minors. Those books are so explicit, they'd be rated X if they were movies. The content is so bad that after a parent read them at a school board meeting, the district took down the live stream from its website because the passages were too inappropriate. And yet many of these books remain in school libraries today. We live in a free country with free expression, but there's a difference between shouting vulgarities from a street corner and assigning them as classroom reading. There's a difference between late-night cable TV and a school library. If school boards and administrators refuse to understand that, if they believe the classroom is about pushing their worldview, then we're on the wrong path. So to the parents who are listening tonight, who are frustrated with what's happening, know that I and members of this legislature have heard you loud and clear. Enough is enough. Parents matter, and we're making sure that you stay in charge of your child's education.
Iowa Senator Jake Chapman went one step further. In his opening day remarks, Chapman claimed the books, some of which deal with LGBTQ issues, were part of a sinister agenda. KCCI's Amanda Rooker talked with Chapman about why he's targeting these books.
Legislation around the book controversy and obscene material controversy was, is the focus going to be on making things transparent for parents, or is the focus going to be on removing materials? I don't know if you're willing to kind of go.
Well, I think it's all of the above. I think we will do everything we can to make it more transparent for parents. But I think it's telling when news stations like KCCI are unwilling to air the actual content of these books. And the reason you can't air it, why KCCI won't air it, is because you're under FCC guidelines, and it's obscene material. You're not permitted to air this, the content of these books. And so if it's not okay on the 5 o'clock news, why is it okay in the 5th grade classroom?
Do you think we'll see legislation on that?
I know you will see legislation on that.
Now, KCCI's Rhea Spigner talked with the Iowa State Education Association President Mike Baranek about this and other education issues coming up in this legislative session.
I am here with Iowa State Education Association President Mike Baranek. We've heard from you throughout the week, so welcome. There's been several issues that you have addressed about social issues in education in a political realm. So let's start with the latest. You recently said Governor Reynolds is adding to the political divide by launching a private school voucher program. So what is that program? And then how does it impact public schools?
Thank you for inviting me back, Rhea. Well, yes, the governor has proposed a voucher plan again this year. And from what I understand, anyone that is 400% above the poverty level, which means about they're earning $106,000 to $109,000 a year, can use public tax dollars and send their children to public or private schools. The reason why this is not a good idea is that we serve 500,000 students here in Iowa. We have a long storied history of high quality public education in Iowa, and our public dollars are meant to be spent on public services. Our public schools are a right of every child born here in Iowa, and we need to be supporting our public schools. As you know, Rhea, we are going through a crisis on many levels. Our teachers, our associates, our entire staff in a public school setting is highly stressed. They are working incredibly hard to meet the needs of their students. And for us to peel off a certain amount of money from the revenues that our schools receive and send that to a private institution is very, very wrong.
Okay, so let's dive into another realm of the school that we're talking about, or the school's programs. You also had strong sentiments in response to Senator Jake Chapman, who called some curriculum and books in schools a sinister agenda. So why do you think it was important to address that message?
Oh, what the senator said this week was highly inappropriate and should never have been said. Our educators here in Iowa, as I mentioned, are working incredibly hard. They need the support from not only our legislators, but our communities. School districts across Iowa have committees that review curriculum that comes into the district. They have parental involvement in many locations. We have in our school systems policies and procedures that allow parents, foster care providers, and guardians the option to remove their children from a particular curricular area or a subject matter that's being taught, or request that their students don't read materials. And so this idea that we need to have further control at the state level about what is happening at the local level is inappropriate.
Thank you so much for joining us and answering those questions. President Mike Boronik with us.
Thank you.
Well, as COVID cases rise, so does demand for COVID testing, which you need to know to get that testing for free.
Floor & Decor, my go-to to get it all.
Well, this weekend, a new program from the Biden administration requires private insurance companies to pay for as many as 8 COVID tests a month per person. I talked with Caitlin Donovan with the National Patient Advocate Foundation to see how this program works.
Your insurer might tell you that they have preferred places for you to pick up a test. And if you go to one of those preferred places, be it CVS, Walgreens, your local independent pharmacy, it will cost you nothing to get a COVID test there. You just have to have your insurance card. If, on the other hand, they don't set up a preferred network, you can buy it anywhere, but you're going to have to send in your receipts for reimbursement. You'll be able to get more than 1 free test. You'll be able to get up to 4 free tests per family member per month. If you go out of network, they have to pay you back at least $12, which is kind of like minimum wage. I wouldn't expect them to pay back more than $12. However, if you set up any networks at all, and they just tell you to send in your receipts, they're going to pay you back at the full cost of whatever you paid for them. for people who are uninsured or on Medicare, that there will be a federally run website where they can order free tests. And those tests will start shipping January 22nd. Unfortunately, Medicare patients, it doesn't look like they have that same option to go to their local CVS or Walgreens and pick up a test at no cost. So we're really hopeful that that's the next thing that comes down. Although as far as children testing, the Biden administration just announced today that they would be shipping 10 million tests out to schools and supporting schools in high-risk areas with federally run labs and programs. So there's a chance that if you have kids in school and they have to quarantine and you need to test them, that you can go to the school itself or get school-specific hours at your local pharmacy and get a free test that way.
Any concern here that people might hoard and price gouge tests with free access to up to 8 per person in a family per month? Is there any concern regarding that with health insurance companies and patients right now?
I think that's happening right now. So my biggest concern with the test is getting the test into the stores. There are always going to be people who get more than they need, but we're all going to need tests eventually.
What would you tell people who want to get tested, but are really wanting that to be in place where they can just show their insurance card and not have to have an exchange of money? What will be coming for them?
If you don't have the cash on hand to pay up front and get reimbursed later, definitely use that federally run website. You'll have to wait 10 more days to get your first test, but that might be the best option.
Almost 1,000 COVID patients in Iowa hospitals right now. The short-term measures doctors say can help cut down that number.
Grand Canyon.
Friday, state health officials reported 998 COVID patients in Iowa hospitals. That's the highest number since early December of 2020. Nearly 70% of those COVID patients are not fully vaccinated. Dr. Suresh Gunasekaran with University of Iowa Hospitals says COVID patient numbers could drop if Iowans take a few temporary precautions.
We've never seen this many healthcare workers who have been infected or have to take care of loved ones that are infected. And so we are seeing significant workforce shortages directly related to the level of infection in the state of Iowa. We think that we're in a critical moment here in Iowa over the next 4 weeks relative to the Omicron variant and the surge related with it in the state. We know that if we can recommit ourselves during this period of time, that we can significantly help avoid overwhelming the healthcare system. And so we really ask Iowans to make good decisions around avoiding gatherings, make different decisions around making sure that they're wearing their masks, make sure that we're distancing in all of our areas. This is a critical time. This is not something that we're going to have to do for the entire pandemic, but making these decisions differently over the next 4 to 6 weeks could be really critical to supporting the healthcare system here in Iowa for all Iowans.
So Tony Lays did have a question about the supply of monoclonal antibodies and the new antiviral pills, and the fact that they're in short supply right now. Are you optimistic about the situation improving?
I am. First of all, to confirm, they are in short supply nationally, and how it's being distributed down to Iowa continues to be challenging. I don't think Iowa's disadvantaged in any way, but I'm just saying that we see the same shortages that others are seeing. It's a production shortage and a distribution shortage. So we anticipate that to get better through the calendar year, but we don't think that's going to be resolved in days or weeks. That's going to be resolved in months.
David Pitt is hoping that you can debunk the idea that the variant isn't as bad as other variants, and you don't get as sick, and that getting COVID gives you natural immunity.
There is no significant evidence that having had COVID is equivalent to vaccination. We continue to have significant data that shows the value of vaccination, and there isn't conclusive evidence that prior infection is effective in preventing Omicron spread. And so what I would say is, again, the greatest body of knowledge that we have is around vaccine effectiveness. And I don't believe prior COVID infection has been proven as an effective substitute. And so I think this is a really pivotal moment. And the other thing we need to emphasize is, I don't see this as an endless period of time. What we've seen for other Omicron surges is there's a critical period of time, 3-4 weeks towards the peak. And we believe the peak is just beginning. So the next 3-4 weeks we think are just critical. And if we make the right decisions and everyone makes a little personal sacrifice in terms of what they're willing to do, we really think that the peak won't be as high, and perhaps it wouldn't last as long. We see this more as hopefully a temporary phenomena, but that's really going to be decided by how Iowans handle this phase of the pandemic.
Thank you for joining us for KCCI 8 News Close Up. We will see you back here same time next Sunday. Have yourself a fantastic day.